Hi everyone. Hi everyone. So my name is Dr. Tehseen. I'm a GP at Spring Hill Practice in Stamford Hill. Really pleased to be back here for the third event, talking about the COVID vaccination and the particularly answering questions that you have submitted. So yeah, thank you for joining us today. So I am, as I said, a GP at Spring Hill Practice, but I'm also the clinical director for the vaccination centres at Bucking Street and John Scott Health Centre. And I also have a vaccines role across London. So really interested in hearing about the vaccines and learning at these kinds of events. So thank you for being here. I'll hand over to my colleague, Heggy, who will introduce herself, and then I'll talk a bit about how this session will run. Thanks, Heggy.
Hey, good evening. My name is Heggy Wyatt. I'm an advanced nurse practitioner at Lower Clapton Group Practice near Hackney Baths. My background is a little bit in epidemiology from the School of Hygiene, a little bit of anthropology from UCL, and obviously I've been working in Hackney since 2006. Excuse me. So I know Hackney really quite well, and the lovely communities. Over to you again.
Thanks, Heggy. So this session is, we're doing this so that you can ask any questions. So please feel free to use the Q&A box in the Zoom, in the box there, in the menu options, but you can also use the chat function if you find that easier. I know sometimes, depending on whether you're using a phone or an iPad, the Q&A box doesn't always come up, so feel free to use either the chat function or the Q&A. And really, we're here to try and answer any of the questions that you have or any concerns, and answer any of the pre-submitted questions that you've sent us. We know that COVID and the COVID vaccine causes a lot of anxiety in people. We know that there's lots of questions. Everything's happened very quickly, and I think it's natural to have questions. So we hope to give you some balanced information tonight to try and weigh up, so that you can weigh up whether to have the vaccine or not. We're not here to try and convince you to have the vaccine. Ultimately, it's your decision. What we want to do is make sure that you have enough balanced information to make that decision for yourself and for your family. Because I think that if you look at the data of the vaccination programme and how successful it's been within the UK and also across the world, actually we're really benefiting from that now. And now we're at a crucial point, given the new Omicron variant, where we really want to refocus efforts on trying to get as many people vaccinated, both for the booster, but also for the first and second dose, where it's not been given. So that's the aim of tonight, and I think it's important that we say that. But alongside the vaccination, there are other key messages that I want to reiterate about how to reduce your likelihood of catching COVID or spreading it to others. So the first one is to stay at home if you feel unwell, to order a PCR test by going online on the NHS website, or calling 119 for a PCR test if you have any cold-like symptoms, so runny nose, cough, fever, shortness of breath, kind of itchy throat sensation, if you're feeling excessively tired. So there's quite a broad spectrum of symptoms of COVID beyond the initial symptoms that we first started with, which were the shortness of breath, cough, and fever. So if you're feeling unwell at all, then please order a PCR test and check that you've not got COVID. We also, I mean, I was in the surgery yesterday, and I saw a lot of positive cases for COVID, unfortunately, because of this new variant spreading. It's doubling every 2 days, and we do think that it's now become the predominant strain within the UK. And we also know that it's more transmissible, so you're more likely to spread it to other people if you have it. So it's even more important to stay at home if you do feel unwell, and obviously order the PCR test as soon as possible. The other guidance around staying safe, washing your hands as frequently as is possible, also using a mask, because that helps limit the virus spreading to other people, particularly if you have a cough, but it also helps to protect yourself. And also keeping social distancing, so making sure that you're 2 meters away, and working from home if you can, given the latest guidance changes from the government. Obviously, there's some jobs that are you can't do it, like Heggy and I have to go to the surgery, and if you are public facing, then you will need to, but where possible, the guidance now is to work from home. And the other thing is, given that, and we don't know what the advice around Christmas is going to be. I think the government is still reviewing that, but it's likely that you know, that there might be some you know, that there will be some mixing inevitably, given we're coming up to the festive period. So if you are seeing friends and family, to try and limit it to as few people as possible, and open a window if you're out indoors, because that ventilation helps disperse the virus. If one of you does have it, it helps protect you by taking it away from the internal environment. And ideally, I know it's not always possible given that we're in winter, meeting outdoors in small groups is actually one of the safest ways of socializing. And we know that socializing is important for human beings. We are social creatures, and it's important to you know, to keep that contact with friends and families. And I think that was the most difficult part of the first and second wave. So it's the key thing is to try and do it as safely as possible. So as few people as possible, outdoors if you can, and if you are indoors, then opening a window or opening a couple of windows to create a stream of airflow in the room would be really helpful. And then the last thing is to make sure that you do lateral flow tests, even if you are feeling well. So you can order these. I know that there have been some issues trying to order them off from the government website. I think the council do have some lateral flow tests, so we'll make details available about how you can access them, because even if you haven't got symptoms, it's useful to keep doing twice weekly lateral flow tests. And that is a way of knowing if you have been inadvertently infected with COVID, but you are not yet displaying symptoms of COVID itself. But just to reiterate, lateral flow testing is only for routine checking. It's almost like a check to make sure you haven't got COVID. It's not for if you have symptoms like cold-like symptoms, cough, fever. In that instance, you order a PCR test, and you can do that online by searching for PCR test NHS, and that will take you to the relevant link, or you call 119. I know it's a bit confusing, and I've had quite a few patient queries where they'd be doing lateral flow tests once they get symptoms, but it should be for asymptomatic, for screening more so than diagnosing COVID. So the idea today, as I said, is to answer as many questions as possible, so feel free to use the box. But if you have specific medical advice, it's always worth getting in touch with your GP or pharmacist, particularly if you have medical complications where we might not know the full story and might not be able to guide you in a specific way. So with that, we can go on to the questions. And like I said, I'll keep an eye out for any popping into the chat box, but sometimes I do forget. So Heggy, feel free to interrupt if you do see any in the Q&A box. So the first question for you, Heggy, is if COVID is mainly a mild illness for children and young people, my concern is that we don't know enough about the long-term effects of the new vaccine to justify vaccinating our children. How would you answer that?
Oh, a really good question. And it's something that we've had to talk about regarding flu vaccines in children as well over the years. As we know, children very rarely get flu very seriously, but we do vaccinate them for a number of different reasons. We do also know the effects of long-term effects of COVID infection in children. We know that children can get troubling effects from COVID infection. We know that children, perhaps up to 1 in 7 children, can get long COVID. They still have effects 15 weeks after infection. 1 in 7 children, that's quite a significant number. So although it's not something that's necessarily going to put children into hospital or ITU, it's still very serious. It's still a very serious thing, and something we can't disregard. You asked about sort of long-term effects. There's something that we call plausible mechanisms when we're talking about medical science. So we look at what we know about the contents of the vaccines, how they work with your cells and systems, what might happen to those cells and systems. And we know that vaccines themselves, especially these COVID vaccines, break down really fast. And they don't leave any effects apart from the effects on your antibodies and then your B cells and T cells, which probably a lot of you have heard about, which are the long-lasting effects that your body then defends yourself against the infection the vaccine's targeting.
Great, thanks, Heggy. That's really helpful. So the next question is whether children have been involved in any vaccination trials. And the answer to that is yes, there have been trials involving children, and a vaccine only gets authorized to be used in the population once it goes through certain due diligence. So people are recruited into trials, tested in lots of different types of people, so those with underlying health conditions, those who are healthy, of different age groups, of different ethnicities, and only once you're sure that, or a drug company is sure that it's safe to launch to market, will it get to that stage. And so there have been trials of using the vaccines on children. The only one that we use is the Pfizer vaccine, because that's the one that specifically has been tested and it's been shown to be both safe and effective. And both the Medical Health Regulatory Authority has approved that, and the Joint Vaccinations and Immunisation Committee has also approved vaccinations for 12 to 15-year-olds. And so there's the trial data, and then there's also the real life data. I mean, across the world, we've administered probably millions of doses to children as young as probably 5 and 6, and it might be in the future that we extend it to younger children. At the moment, we're doing 12 to 15-year-olds, but there is clear evidence that, just as Heggy said, although in some children it can be very mild, COVID, just like flu can, there are particularly those children who have underlying health conditions where actually they are at risk of serious COVID disease and infection and things like long COVID. So it's important to protect them. But the other aspect is that actually children, obviously going to school, they have a reservoir of viruses. So we'll know that at this time of year where kids get repeated colds and coughs. And the risk is that if children have COVID, there's a risk to themselves, but also they can then spread it to their parents, their grandparents, their community. So there is a double reason for vaccinating children: A, to protect themselves, and B, to protect other people. So overall, the answer to that question is yes, there have been trials and real life study. Now, all vaccinations have risks, and it's important to say that. So there have been unexpected events that have come up. So, for example, there is a small theoretical risk in children that you can cause heart inflammation, something called myocarditis, and that has been it's a very, very low risk. It's kind of 10 in a million, I think, the rate of that. So it's extremely rare, but it is a complication that has happened in some children. As far as I know, those children who it's affected have made a full recovery and have not had any long-term complications or any subsequent complications from that. And also the other point to note with risks of vaccines is that you've got to weigh it up against the risk of having COVID. So we know that COVID itself can cause things like heart inflammation, and that's a much greater risk than actually a vaccine ever would be. So overall, again, the evidence is in favour of vaccinating 12 to 15-year-olds, and potentially in the future, like I said, going into even younger cohorts, because on a population level, that protects the population, but it also protects them. Heggy, the next question is, I think it's very much related actually. How do we know that the vaccine has no long-term effects on pubescent children who are still developing? So this is more about, I guess, children who are 12 to 15. Are there any long-term implications of that?
Yeah, so again, we look at whether there's any reason to think that it might have a developmental effect, perhaps on how they grow, or a big immune challenge or something like that. I think people worry about this that side of it. we do know, as we've already said, that there are millions of children who've been vaccinated in other countries from the age of 5 all the way up to 18. And there's no reason to suspect that there are any long-term effects coming from the administration of vaccine in that age group. The vaccines themselves are broken down so quickly in the body, and that's all that's left is the effect on the memory of your immune system, knowing what your immune system should respond to in terms of those little molecules that are taken into the body by the vaccine, which your body then learns how to replicate, and teaches your immune system then what to defend you against. As I said before, we've got the risks of long COVID. We know also that some children have underlying conditions, which means that they're more at risk, as you mentioned. And it's really, really important that these children are protected, because a big infective challenge to them would delay their development hugely. And the other thing that I think I didn't mention earlier is about the disruptions of children's schooling and children's social life. I think that can't be underestimated. Children, especially children on their own, children who live in single child households, being disrupted, being isolated, not having a social life, missing out on their education, it can have an enormous emotional, mental health effect, and also an effect on how they succeed later on when they're adults. Are they going to be able to reach their potentials? And we take all of those things into account when we're looking at a children's vaccine campaign.
Thanks, Heggy. That's a really really helpful response. Actually, I'm going to ask you the next question because it's related to children. So the risks of COVID vaccine on the reproductive system and mental health of children.
Yeah, I mean, a really good question. And mental health of children is something that has come to the fore with the isolation, disruption to education, the fact that those other adults in their world, their teachers, perhaps their social workers, their nursery nurses, haven't been around in the same way, supporting them, watching for if they're becoming sad or anxious. And that set against the risks of vaccine, there's never been a vaccine ever that has affected anyone's mental health. It doesn't happen. COVID infection, however, and a lot of viruses do have an effect on people's mood. We know that especially flu, for example, has a very serious effect and a measurable effect on mood. And that can be long after the infection itself. It's probably due to inflammation in the person's neurological system. And it's a really important thing that's not often mentioned about infections.
Thanks, Heggy. That's a really good point. And I actually have patients that are fit and well, that then got COVID last year and have ended up with long COVID symptoms, and some of those symptoms manifest as cognitive, so they're affecting things like mood and thinking, concentration. People describe this brain fog that lasts even months after getting the infection. So I think I just reiterate that long COVID is a risk, and we think around 7 to 10% of people that end up getting COVID have long COVID symptoms months after the initial infection. So actually the question of the mental health of children is that actually the best protection for that is to have the vaccine and to have both doses of the vaccine for children between the ages of 12 to 15. And actually also what we know about the vaccine is that it does protect against serious infection. And remember that the aim of the vaccination is to reduce severe infection and hospitalizations and reduce the death rate, which was really high in the first and second wave. Now, we're obviously in a very precarious position now with the Omicron variant, We don't know yet how severe it will be and what that will mean in terms of the severe hospitalizations, intensive care, and also death rates coming in the next few weeks and months. But the best way to protect the entire population is by having the first dose if you haven't already had it, the second dose if it's been 8 weeks or more since having the first dose, and then having the booster. So if you're eligible for that, and this applies to adults at the moment, we're not offering it to children, but as of now, if you're over the age of 30 and it's been more than 3 months since your second dose of the vaccine, you can actually book for a booster vaccine now, and that is the best way to protect yourself against the new Omicron variant. The general line is that 2 doses for the new variant isn't enough. So you do need the 3 doses to protect yourself and others. So if you are eligible, if you're over the age of 30, then you can book now. The expectation is by tomorrow that will change. So anyone over the age of 18 who will be eligible for a booster vaccine as long as they had their second dose 3 months prior to the booster. So that will open up online. And I know there's been some problems trying to book in because I think all the vaccination centres have been really busy trying to vaccinate everyone since the announcement on Monday. But I think it's important to point that out now that this is coming, that actually even now you can book if you're 30 and over, and if you're over 18 you can book from tomorrow onwards for the booster vaccine, and that's the best way to protect our population in City and Hackney. But also, if you have had the vaccine and you're thinking about the booster, to actually talk to your friends and family who haven't yet had their first dose, because what we're worried about in City and Hackney are those people that haven't even come for their first dose, let alone their booster. And there's quite a large proportion of our population, some of whom are really high risk by virtue of age or ethnic group. So we know that COVID affects Black and minority ethnic groups disproportionately. It led to more deaths of Black and Asian people in the first and second wave. And we're a diverse borough, so we are worried about that. We also know that we've got people that are housebound and those with underlying health conditions that are yet to have their first dose. So please talk to your friends and family and try to encourage them to come forward and have the vaccine. Although the focus at the moment will be the booster, it's never too late to come back and come back to us and have the first dose. And I hope that messaging isn't diluted over the next few weeks. We certainly will keep reminding you to have the vaccine as much as possible. And I think Olga's put into the chat the pop-up sites as well, because there are appointments that you can book for the booster, but there are also vaccination sites where you can just turn up. So pharmacies in particular and other sites around the borough, you can actually turn up without an appointment to have the vaccine. So that was a long answer to that question, but I thought it was important, and I don't think I covered it in the previous intro, so I thought it was important to say that now.
I think also Tehseen, it's really important for people to understand how low the vaccine coverage is in Hackney at the moment. We are one of the lowest in the country, so we are very worried, and we're all talking to patients and sending out the home visiting teams to patients whose oxygen levels are into the 80%, and that gives us a really sad feeling. It's a bit of a panicky feeling I get when I know that a patient is that sick and at home, and that they might have not been in that situation because these people haven't had vaccines. So it's a really important thing to know that the rest of the people around you aren't protecting you in the same way as a lot of other vaccines you might have avoided. It's a very scary situation for all of us.
Absolutely, Heggy. Yeah, I would completely agree with that. We've got quite a lot of patients from the surgery who are in exactly the same situation. And yeah, particular focus in City and Hackney because we have got low uptake. And the implications of that are that people get sick, obviously, and then end up in A&E at the Homerton or other hospitals. And then it creates problems within capacity at the hospital, but also the disruption to other services. So whether that's cancer services or other acute services, that actually the NHS was only just trying to get on top of the backlog because of the first and second wave. So you're right. I think we are scared about what actually the winter holds. So really important to try and reiterate that message that if you haven't had the first dose, please do come forward. And actually, if you haven't had the first dose, I would say that you don't even need an appointment. You can just turn up to John Scott and Bocking Street, because we are prioritising. For the booster, it's slightly different because there's quite a lot of demand over the last few days, and we've had to turn some people away. We're hoping to increase capacity, but if you get to have the first dose or you do your second dose, you don't need to book in. Just turn up at John Scott and Bocking Street and you can be vaccinated. And we are making sure that those people that are eligible for the first dose are getting it if they are turning up at the vaccination centres. Sorry, I'm conscious of time, and there's still quite a few questions, so I'm going to try and do a couple maybe.
We missed one going back about somebody taking iron supplements, Tehseen.
Oh yeah. So this was also submitted, and yeah, I mean, there's no problem with taking the vaccine and having medication. And I'd probably also say that if you have an underlying health condition, it's all the more important that you get the vaccine, because that means you're potentially at disease and complications. So absolutely fine. There's very few scenarios, and this links actually to one of the later questions, I believe, that there's very few scenarios where the vaccine isn't suitable for you. And even if, say, for example, you've got a history of allergies to vaccines and serious allergies to vaccines, there is an allergy clinic that we refer you to have the vaccine there. So really, the suitability of the vaccine really applies to most people, 99.9% of the population, I would say. So I hope that that's cleared up that specific question. There's also then the question of, previously we were told that there was one dose suitable for children. Now there's a suggestion that they should have two. I mean, the question to that is that, the answer to that is that I think COVID is still a relatively new disease. We developed the vaccine quickly because we had all the technology lined up. There was a lot of government resource across the world because it affected all the countries across the world. And so there was a focus, and a lot of the red tape in developing the vaccine was cut out. So we were able to get to the point of actually testing it on people, on tens of thousands of people, including myself. So I was in the AstraZeneca trial, and people were recruited very quickly compared to other trials. And the reason I'm saying that is because I know that sometimes people are concerned why the vaccines were developed so quickly. And that is because everything was lined up in the right way. We already had the technology from the SARS virus in the early noughties. And so it was just a matter of time. We were just waiting in some ways, for the next virus, and we were able to then mobilize all the technology. But it's related to this question about why 2 doses now, is because I think that this is the nature of science. So with science, you test something, and sometimes you have to adapt things based on what you find from that testing. So there was the trials data. And then when we implemented it in real life, we found on a population level that at the point that we were at, 1 dose was deemed to be okay. But then when we started following up those people that had 1 dose. So for example, I still go for blood tests for my AstraZeneca vaccine. They were measuring people's immunity, and they found that actually it starts to reduce after a while. And that's why a decision was made to introduce a 2nd dose for children. And also the same principle applies to why we're having the booster vaccine, because there is some evidence that your immunity starts to reduce down after 6 months. And that's why it's important to have the vaccine. It's been shortened now to 3 months, given where we are because of the Omicron variant. And there's evidence to show that if you have had the booster relatively recently, your antibodies go up within days. So it's 75% effective against the Omicron variant. So again, really important that we see the booster as a 3rd dose, not as an added bonus. It really is important with this new variant that if you are eligible for it, that you come forward and have the booster vaccine to protect yourself and to protect your household, your loved ones, and your community as well. Heggy, the next one is about someone being worried about vaccines because they're afraid of needles, and looking away doesn't help because even thinking about needles makes them feel dizzy. So they wanted a bit of advice about that.
Absolutely, and it's something we come across at the vaccine centres a lot. We're very used to it, and I feel quite sick when I have needles, any blood tests or vaccines. I feel really quite sick. People laugh a lot when they're giving me my vaccines. I've got over it to an extent. I just shriek a lot. The main vaccine centres are so used to people who are really needle phobic, who feel sick, who feel faint. It's so common. What we would do is, if you wanted to lie down prior to the vaccination, have a glass of water, take your time. Somebody can be with you, ask you when you're ready. You can stay lying down, have a glass of water afterwards. It's something that we can support and help you with, and it really does make you feel quite horrid if you've got that sort of phobia. I absolutely feel for you. I would say that most of the pharmacies, I don't know if they'll have couches though, so it might be that you'd want to book at one of the John Scott or Barking Streets for your vaccination, and make sure that people are aware of your phobia.
Thanks, Heggy. And I would also echo that the staff at the vaccination centres are really used to this and very friendly. So we'll try our best to put you at ease. The next question is about side effects that women have had during their period and what causes heavy menstrual bleeding after receiving the vaccination, and is there a potential link to fertility in this side effect? So this comes up very frequently. First of all, the link to fertility is that there is no evidence that having the vaccine affects fertility. There's on a population level, again, those people that have the vaccine have had successful pregnancies and healthy pregnancies. So there's no link there. I know there was something right at the beginning of the Pfizer vaccine in particular, where people were worried about new technology and whether that would cause problems with fertility, but that was misinformation, and it's been proved incorrect. So no link to infertility. And again, the other important thing to note is having COVID infection can affect fertility. So we know that sperm count reduces for men, and there can be disruption in periods for women as well. So again, with all side effects, with all risks, what I like to do is compare it to actually having the disease of COVID. And fertility is no different. But there is no link to having the vaccine and subfertility or infertility. With regards to the menstrual cycle disruption, so there have been cases of disruption, so either heavier periods or actually a missed period because of the vaccine or a delayed period. We don't really know why that is. We think that actually on a population level, again, if you take the whole UK's population and all the people who have periods in the UK, we know that some of those people will have disrupted periods. It's quite common to go through hormonal changes. Lots of things can affect periods, such as stress, changes in lifestyle, changes in weight. And so the chance of having a disrupted period is quite high anyway. So some of it might be a red herring, that if you've been vaccinated and you've had a disrupted period, but there is a theoretical link that some people have made to having the vaccination. And we think it's probably because a short-term impact on your hormones for probably a few weeks, which means that you have a delayed period. In all those women, and in all those cases where there have been disruptions in in periods, it has gone back to normal the following month or the month after that. There have been no cases where this has become a persistent issue. And again, going back to the fertility, there's been no cases where women have stopped having periods and therefore have become infertile with either of the vaccines, whether it's AstraZeneca, Moderna or Pfizer. So really want to reiterate that point, that actually there is no link between fertility issues or long-term menstruation issues and having the vaccine. The next question is about under 12s being vaccinated. So again, we've touched on that. We think that in the future, perhaps in the new year, the vaccination program will be extended to 5 to 11-year-olds, but there's been no JCVI guidance around that. Obviously, we'll know more probably when in the new year when that's announced. The next question is about having the first dose of the AstraZeneca within 24 hours. This person was had restless legs, nearly collapsed 2 times whilst going to the bathroom at night. Their GP said that the blood pressure must have dropped. And this has made them apprehensive in having a second dose, and they don't know what to do. Heggy, can you provide some advice about what to do in this situation?
Yeah, gosh, the COVID jabs do have side effects. Most of them are short term. And I know that that some of our team have felt so unwell that they needed to take a day off after their boosters more recently, and even after their first or second doses back in December and January last year. Seems so long ago now. So they do have quite an immune kick, which hasn't put any of us off. We just got a little note from HR saying, try to book your booster on a day before you're not working. I'm sorry you felt so grotty, though. It's a bit of a shock sometimes that you feel so grotty after vaccinations, and I know some people get them after travel vaccinations, especially tetanus seems to give people quite an immune punch. It sounds like from what you said that it just happened at that night and then things got better, which is what I'd expect. So I wouldn't expect anything to happen after the first few days. I think you're unlikely to get the same side effects again. It's certainly not been my experience with my patients or my colleagues, but it is possible. I usually suggest that people take some paracetamol or a normal painkiller that you would normally take as a sort of prevention, make you feel a little bit more comfortable if you're worried, and it won't affect how effective the vaccine is going on experience with other vaccines. I wouldn't want you to be put off having a reinforcing dose, though.
Thanks, Heggy. Next question is about a 12-year-old, whether they can get vaccinated now or before they turn 12. Again, if they are 12, then yeah, absolutely they can get booked in and be vaccinated. So feel free to go ahead and book that at the vaccination centres or at schools, although I think a lot of the schools have already had their vaccination offer, so it will be at the vaccination centres that you can get your 12-year-old vaccinated. And then there's a question around clarifying whether some guidance applies to health or social care workers working with children and young people, and the government, it's around the government announcement of having to have all healthcare workers vaccinated by April as a condition of deployment. So you basically, as with social care workers, where they had a deadline to be vaccinated, the next step is for all health workers to be vaccinated by April, which means that you'd have to have your first dose by February to then receive your second dose by April to actually carry on working with your clients or your patients. And the guidance is quite clear that yeah, it does include people that work with anyone who's vulnerable, any public-facing role that is allied healthcare worker or has contact with particularly vulnerable people. So yeah, I would say that if you have, and that's part of the reason why we're having these webinars, is to try and I guess build confidence. If you have any specific issues that you want to, and if you're here now and there's any specific questions or concerns that you have that's stopping you from getting the vaccine, please feel free to ask them. But that certainly is the guidance, that from April, to be a healthcare worker, you would need to have 2 doses of the COVID vaccine. It doesn't yet apply to the booster, because people might not be eligible by then, but certainly for the 2 doses, that needs to happen by April. So there'll no doubt be guidance from your workplace around that, because we're doing quite a lot of engagement with those people that are unvaccinated healthcare workers. So the next question is about the difference between the Moderna, AstraZeneca and Pfizer vaccine. So we weren't sure whether this was in terms of the technology and how it works or the effectiveness. But I mean, I'm happy to talk through the basic concepts of how these vaccines work. So AstraZeneca is what we call a vector-based vaccine. So it's a traditional vaccine where it uses a part of a virus, a part of the COVID virus, and only the coat of it. So it has all the ingredients for the body to react to it. So when you're injected with this AstraZeneca vaccine, the immune system recognizes it as a foreign invader, and then produces antibodies to try and neutralize it, and neutralizes that virus or viral component. You then build up long-term immunity, and the antibodies last for after the first dose, probably for a couple of months, and then with the second dose last around 6 months. In some cases a bit longer than that, but it's around 6 months that immunity lasts for. So and hence the reason why we're boosting people. So that's a traditional a vaccine that we've used for decades. So again, going back to the safety issue, we know how to develop vaccines. We've been using them for decades, and this technology is not new. In terms of the Moderna and Pfizer vaccines, so they are both what we call mRNA vaccines. So they use a small amount of genetic material from COVID. And I know this in itself had concerned quite a lot of people, because they thought that the vaccine was going to be changing their DNA. But just to reassure you, this is not DNA, it's mRNA. So it's just a recipe, almost a short-lived recipe, which is a new technology. We've known about it since, as I said, the SARS virus outbreak in the early 2000s. And so the technology has been around for a while, but this is the first time it's been deployed in a vaccine, and it's really exciting. I think it has huge potential for future diseases, for future viruses or parasites, for example, and it could have huge impact on, positive impact on the human species against protecting us from all sorts of infectious diseases. So that technology is new, but the viral component, the way it works is that the mRNA, it goes into your white cell, and it goes into certain parts of the cell and basically tells your cells to produce antibodies, and that then again protects you in the long term against COVID infection, because then when you encounter the virus in reality, those antibodies still are around within cells, and so your memory cells attach to the COVID virus, and you produce rapidly a set of antibodies because you've already got the recipe of how to produce them, and you've got the record there. It's almost like a library of how to fight infections, and so you just take out that book and you fight that virus and neutralize it. The mRNA components, that genetic component that people are really concerned about, that destroys itself after a while. So this is not going to be changing your body's DNA. It's not going to be going anywhere near your nucleus where the DNA is stored. So really want to reiterate that message. So both Moderna and Pfizer work in that similar way, and they're both as effective. So is AstraZeneca. I mean, I often say that the most effective vaccine is the one that's going into your arm. We know that all three of them are very effective vaccines. Both, we only use the AstraZeneca for those people under the age of 40. And to be honest, the supply of AstraZeneca has been reduced over the past few weeks and months. It might be that that's the only vaccine that's suitable for you, perhaps if you've had a severe allergy after the first dose of Pfizer, which is rare, in which case you'd be offered the AstraZeneca, but we've seen less and less of it now. And it is mainly Pfizer and Moderna, particularly for the booster vaccine, because it rapidly produces, gets your body to produce antibodies. And we know that the effectiveness of the Pfizer and Moderna is, for the Omicron variant, we think is about 70 to 75%. So that's the predominant one that we're using at the vaccine centres and pharmacies and other sites across the city in Hackney. The next question is about...
Just to add on, I think it's important we're talking about how, when talking about effectiveness, I've had a lot of people who've asked about what effectiveness actually means. There's quite a lot of information going around that it doesn't stop people getting it and they can still pass it on. Now, when we're talking about 90% effectiveness or 73% effectiveness, we're actually talking about not getting the infection. Not getting the infection at all. And if you don't get the infection at all, you can't pass it on. So the people who can get it and then pass it on are the people in that small percentage who might not know they've got it because they've been vaccinated, so they get a very mild form. Or people who are going to get it more seriously and still have active virus that they're getting out of their nose and their respiratory tract, and that's a very small percentage of the people who've been vaccinated. It's still true that all the vaccines, particularly with the booster, stop you, in terms of effectiveness, stop you being admitted to hospital, which is incredibly useful. And then when we're talking about the knock-on effects of my patients who've been waiting for 2 years for a hip transplant and they can't have it because you need an ITU bed free, and you can't have an ITU bed free if somebody's in it receiving oxygen because they've got an infection with COVID. So it's, if we say it's 73% effective, it stops you getting infected. You cannot pass it on. It's only a small proportion of people who might still get it and then pass it on.
Thanks, Heggy. Yeah, I think that, again, that is a really good point to reiterate, that there is evidence that it reduces transmission and, importantly, reduces the severity of the disease. And if you look at, I mean, I always say this, that even one death with COVID is one death too many. But if you look at where we are with the number of infections, of over 50,000 a day, compared to the first and second wave, our death rate is a lot lower. So that's proof that the vaccination programme is working in trying to protect our most vulnerable communities and residents from serious disease and death. Very quickly, again, conscious of time, the next question is about the consent process for those under 18s and how that works. So it works exactly the same with vaccines in general. So you'll be given information about the vaccine, and part of the consent procedure is even this webinar informing you about the positives and the negatives of having the vaccine, and then you weigh up whether that's the right decision for you. So with children, there will be the opportunity for parents to provide consent for their child to have the vaccine, and there might be cases where, and we see this quite rarely, where actually, for example, the child wants the vaccine and the parent doesn't want them to have the vaccine. Now, in the schools offer, we had to have parental consent in order to vaccinate, but at the vaccination centres, there are exceptions where a child might want to come with someone else to have the vaccine, even if their parents don't want them to. And at that point, we'll have to see whether that child is able to weigh up information and able to have capacity to decide whether it's the right thing for them. And if they're deemed to have that capacity to be able to, and that competence to be able to provide consent, then we will vaccinate them if they're over the age of 13, as per we would do for any other resident over the age of 13 when they come to their GP for other reasons as well. And then the next question is linked about what's the difference between getting vaccinated in school and outside of school. Nothing really. So we tried to get the in-school offer first, but it was delayed slightly. So a lot of children did get vaccinated at the local vaccination centre, but there's no difference in that. And again, just in the interest of time, I'm going to go on to the next question, which is the pregnant. Is there an ideal time to take a booster when you're pregnant? e.g. the first or second trimester. Again, I've seen this quite a lot from patients. There is no good time. It's any time to get, if you haven't had the first or the second dose, or you're eligible for a booster and you happen to be pregnant, have the vaccine regardless of where you are in your pregnancy. We've seen some really tragic cases, particularly over the summer, of pregnant women ending up on intensive care, dying from COVID as well, and losing their babies because of serious infection, because actually being pregnant does put you at higher risk of serious COVID infection and death. So please have the vaccine regardless of whatever stage of pregnancy you're in. The next question is, today's the last day of self-isolation as I tested positive for COVID. Will I be able to get the booster jab, or should you wait? 39 years old without any underlying health conditions. So the guidance is to wait for 28 days after having a positive COVID test. And that might be because having the vaccine, because you might have severe COVID symptoms, and that might then get mixed up with having the vaccine. So it's best to wait for 28 days. For children, for 12 to 15-year-old, the guidance is to wait for 12 weeks after they've had a positive COVID test. But for adults, it is 8 weeks. Next one is, I'm asthmatic and I've had 2 doses of AstraZeneca vaccine. Do I need the 3rd dose or the booster vaccine? Heggy, do you want to answer this?
Yeah, so thanks. So you should have the 3rd vaccine when you're invited. If though you have very severe asthma, so that means you've had to take steroids, like steroid tablets, twice in the last couple of years, or you've been admitted to hospital with asthma, then you should have a 3rd dose 8 weeks after your 2nd dose. So that's a 3rd, we'd call it a primary course. We'd have 3. And then the booster after the 3 months in the same way as everybody else, which would be 4 doses in total. If you have asthma that's generally okay, and you take your inhalers every day, as your practice nurse tells you to, then you'll get eligible for a booster 3 months after the 2nd dose in the usual way. So you can book that now if you're over 30, or from tomorrow if you're over 18. And for the booster, it's always Pfizer or Moderna, because they work better as boosters. They're just better at boosting than the AZs, as far as we know at the moment.
Thanks, Heggy. So the last question that we had pre-submitted was, for medical reasons, I've been told that I can't have the booster. My GP can't get advice from NHS England, and I'm left in limbo. Where do I go, as I'm worried I'm not protected? So this is quite a difficult one, because we don't know what your specific medical reasons are. But having said that, and I said this earlier, there are really very few cases where you can't have the COVID vaccine. I can't think of many examples. And like I said, one of the probably the most common, but even that is not very common, is people that have had serious reactions or allergies because of the 1st or 2nd dose, or if they've had a history of allergies that we don't know where the allergies come from, in which case we'll refer you to the allergy clinic. But actually, if you have an underlying health condition, as I said earlier, it's all the more important, because we know that most of the deaths were in older residents, and also those people with underlying health conditions. So I can't think of any underlying health conditions that would mean that you can't have your booster vaccine. I think it's really important to go ahead and have that. But like I said, I don't know the specifics of your medical history, so please discuss it with your GP. Yeah, that was the last question. Were there any other ones that popped up in the, yeah?
Just to say, Tehseen, one of my colleagues actually had an anaphylaxis to an unknown allergen in their medical history, and we sought advice, and actually they were advised just to stay for 30 minutes after their booster in the vaccine clinic. We sought specialist advice from the allergy specialist doctors, and they just had to stay for 30 minutes and they were absolutely fine.
Absolutely, yeah. There's ways we can get around that, whether it's an increased observation period at the vaccine centres, or as I said, the wait, so it's only a couple of weeks to wait for the allergy clinic for the COVID vaccine, so we can also send you to Barts or the Homerton to have it in a very controlled environment where we've got everything set up. I mean, we've got that anyway at the vaccine centres. We have to carry the full anaphylaxis and resuscitation kit if needed. We've never had to use it, thankfully. The most common complication after having the vaccine is people fainting, and we'll see, and more common in men, interestingly, than women. I don't know what that says, but we've seen quite a spate of faints back in the summer, particularly when it was hot, after having your vaccine. But again, still a low risk, but is the most common one. So, yeah, if you have, as Olga's put in the chat, so I really thank you for joining us tonight. But if there are any other questions, then please feel free to use that email address of testandtrace at hackney.gov.uk. And if there are specific medical issues or questions that you think a health professional can answer, then please contact your GP. I know I've had lots of conversations with my patients around the vaccine, and it's easier to get in touch with GPs now through e-consult. So what I've often had is people typing in specific requests or concerns, and I can just email them back that way. So yeah, either through your GP or your pharmacist. And yeah, I think that really what I again want to reiterate is we're at quite a critical time now. We're in a very different position than we were even a week and a half ago, where we were getting on with the booster programme. You know, we still had the challenge in City and Hackney of, exactly as Heggy highlighted, of the unvaccinated population within City and Hackney, who are the ones that I'm particularly worried about. But the world has completely changed in the last week and a half, and now we're at a really critical point. And yes, there are some theories that the Omicron variant is less severe, but we don't know that yet. And also the data that we have is from South Africa, where the population is a lot younger, and we have older residents. We have an older population in the UK, so we don't know how Omicron will show itself within our population. And the best thing you can do to protect yourself and to protect others is to have the booster 3 months after the second dose. And if you haven't yet had the first dose, please come forward and have that done as soon as possible. And as I said, for the first dose or the second dose, you don't even need to turn up to a pharmacy or turn up to the vaccination centres at Bocking Street or John Scott, and we will fit you in without a problem. So yeah, really want to reiterate that message. So Heggy, did you have any final words? If not, we can say thank you and close.
Yeah, no, I think I said go away all the information that I have. It's something we talk to our patients about every day. We're always happy to spend time talking about this, because this is what keeps you all safe.
Thanks a lot, Heggy. And thank you, everyone. Hopefully we'll meet again at another webinar at some point in the future. Have a good evening.
Good night.